Hello friends, I am Dr. P.K. Shukla, a physician in Muradabad, UP. I have been given a chance to deliver a talk on hypertension. As many of us know that out of 63% of the non-communicable diseases, deaths due to non-communicable diseases, 20%, 27% are due to cardiovascular diseases. And out of those, in 45%, hypertension is a risk factor. And that too, these deaths are between the ages of 40 to 70 years of the age, that is maximum productivity age in the life of a person. So hypertension is the most important risk factor for the non-communicable diseases, that is atherosclerotic or cardiovascular diseases. Why so? Mostly it is due to the lack of knowledge among the general population regarding the risks of hypertension and lack of awareness that it can be controlled or it can be reversed even with the lifestyle changes or with proper drug treatment. In India, only 30 to 35, 38% of men and 32% to 28% of females get proper treatment for hypertension. That is about one male in 5 and one female out of 4 women get proper treatment for hypertension. In a simple way, many of us know that half of the patients are diagnosed in India as hypertensives. And out of those half, only half of them take treatment of that. That means only 25% go to the doctor and get the treatment. And out of those 25, only half of them, that is 12.5, take the treatment in a proper way at one time or sometime in their life. Otherwise, rest of them take irregular treatment or taking treatment with some subtherapeutic dosage, or they are taking medicine, but their BP is not controlled. And remaining 12.5% of the patients who are taking the medicine don't follow proper follow-up of their treatment. That means out of total hypertensives in our population in India, roughly 6.25% only get the treatment in a proper way and carry on a proper follow-up. While stage 1 of the hypertension, that is when the blood pressure between 130 or 139 oblique 80/89, lifestyle changes play a very important role. We have seen that even in COVID patients, those who are having hypertension had a bad prognosis. So there is a white collar hypertension when a patient goes to the doctor. Just by telling him that you are having hypertension or fear of the doctor's clinic presence, they become hypertensive, and one can make a person hypertensive just by telling him that your BP is high. So this monitoring of blood pressure at their home or in an ambulatory BP monitoring way or home BP monitoring plays an important role. If we can achieve a 20/10 millimeters of mercury reduction in a hypertensive patient, then the risk of mortality is reduced by 23% in males, and the cardiovascular mortality risk is reduced by 36%. So now there are many ways to control the hypertension. Hypertension is a reversible risk factor or a controllable risk factor. by controlling the weight, one can reduce it. That is, if one if one can achieve a reduction of 5 kg of his weight, then his total drug dosage may be reduced to half. A reduction in 5 kg of his weight from the present weight can make to a half. Now, among the drug therapy, we have got ACE1 inhibitors and ARBs, or plus calcium channel blockers, and then diuretics can be added. We can control the hypertension with the use of ACE inhibitors, ARBs, or with the addition of calcium channel blockers with them and adding diuretics further. It is not only important to control the blood pressure of the patient, but also choosing a drug which can control the comorbidities of the patient related to the hypertension, like atherosclerotic cardiovascular diseases, cardiovascular other complications, fatty liver, diabetes, hypothyroidism, and obesity, dyslipidemias. So we should choose a drug which can prevent or control or improve the comorbidities associated with the hypertension. Thank you very much.